I can still feel some tension in the right part of the stomach, kidney, again adrenal gland. Thumb walking, and here, because it's a wider area, I can do with my two fingers, finger walking all the way, sweeping, and we can do both sides, sweeping, top to bottom, around the ankle area. It feels such a lovely area for, again, this, not knuckling, it looks like I'm knuckling, but I'm not, I'm just sweeping towards me. The reflex part of the body, this top part is a respiratory reflex point, mid part is digestive system reflex point, and the bottom part is the lower back and reproductive reflex around this ankle area. I'm going to start with just 1 or 2 minutes grounding before our session. I'm just going to use wet wipes before we start. Okay, we can start. Hello, my name is Mustafa. I am massage therapist. I specialize in mainly sports injuries and deep tissue bodywork, as well as reflexology and many other modalities. But in this particular session with lovely Melissa, I'm gonna give reflexology. It's not going to be a tutorial such, it's going to be tester session. So I'll do my best to talk through during the session, as well as giving a nice, relaxing reflexology treatment for Melissa. I hope you enjoy it. Obviously, we have done initial consultation, which is very important before we started treatment. We've done that already. So we're going to be just treatment. I've done initial grounding. I prefer when I do reflexology treatment with my clients, if it's possible, I start with grounding, very gentle. It's a very good way of introducing myself to the patient's body, connecting, and starting treatment in this way. And then I sit and hold, feet, trying to feel and sense what feet that I'm working with telling me. And through color, texture, scent, etc. on the feet, you can tell if there is any tension, any condition, or anything like that. By the way, the reflexology is not diagnostic. We don't diagnose this. Alternative complementary treatment, but it's highly beneficial, effective, one of the oldest, incredible treatment that people benefit from it, especially if you have it on a regular basis. I'm just going to put a little bit lotion, not too much, because otherwise it becomes sleepy, and we don't need that. Just a nice, gentle, and I always check in terms of pressure. Some people prefer light, gentle pressure. Some clients prefer medium, which I prefer as well. And some people prefer very firm pressure. It just depends on clients. What is your preferable level of pressure, Melissa? You like gentle, medium?
Probably medium.
Medium, yeah.
Medium or firm, yeah.
If anything feels uncomfortable or too much, too strong, or etc., please let me know.
Okay, thank you.
This is nice. Starting. Just briefly, the reflex part of the body, this top part is a respiratory reflex point, mid part is digestive system reflex point, and the bottom part of the dorsal aspect, plantar aspect, sole of the foot, is the lower back and reproductive reflex around this ankle area. And on right and left, it's like a mirror image. On the right side, right part of the body, reflex points there. Left side, left part of the body, reflex points here. By working on the reflex point, it helps body to rebalance, readjust specific or corresponding organs or glands in the body throughout the body with touch. Depending on the training, every therapist is different. Some therapists start on the right foot, like I do. I prefer, like clockwise and digestive system. I start with right foot and move to left. And I also prefer to work switching, like starting on the right foot and then switch to the left side, back and forth until I finish. Some people works one side, finish, cover, and then move to left one. I prefer switching. So I found much more effective and beneficial. This is lovely, starting to work in the metatarsal joints, just loosening up, and it feels lovely. How does it feel? Is it? Yeah, nice and relaxing, isn't it? This already structurally helps feet to loosen up and a person finds it really relaxing, like Melissa said. Big toe, which is reflex point of head. There's a brain here. Top of the big toe is its sinuses, all here. And I'm going to start. We already did opening. I'm going to start with big toe. Part of the foot, its pituitary gland. Just gently apply acupressure and hold. Okay, so we've done all the lovely toes. Especially this is shoulder reflex on this right side, right shoulder reflex point, and left side is the left shoulder reflex point. Typically, it feels very crunchy, tight when I work with my patient. One of the area that feels crunchy, so I go back that particular reflex point a couple of times to working on it to help to break down that tension, the tightness. And after the session, people feel much looser in general. As you may see, I did just caterpillar walk. This is chest, right part of chest. This is thoracic, esophagus is a bit tight again. And that line is a diaphragm, a wonderful area for stress or anxiety, nervousness, working around this diaphragm line. And sometimes it's good to hold in this solar plexus area. It really helps the client relax. Whole system calms down nicely. Okay. And this is liver under the fourth and third little toes, just under the diaphragm line. That's your liver, gallbladder. If it feels tight, again I apply gentle acupressure, about 30 seconds to help to release. Sometimes client can feel, respond. When I apply pressure here, Melissa, how does it feel?
Yeah, it feels really nice.
Nice. It releases bile.
Yeah. I really like the pressure actually. It's like the perfect strength.
Thank you.
Yeah, I think sometimes it's more gentle and I actually prefer it.
Yeah, if it's too gentle, it can be ticklish, which is not
Yes,
ideal.
yeah.
It's important to check with the client, obviously. But this is the right part of stomach, and the left part here, the other part of the stomach. Also, when we go to other foot, I say about the spleen is on the left side, the right side is the gallbladder. But kidney, adrenal gland, both on the left and right side. Same as intestine. When we come down to intestine part, I'll talk you through. When I apply pressure, for example, the kidney, it feels tight. It feels tight to me. So when I feel any tension, crunchy, or tight tissue, I tend to apply gentle 30-second pressure, checking with my client, and release it. Almost immediately it releases. It feels loose. It's incredible, the reflexology, how quickly you can get results. Okay, we've done. I can still feel some tension in the right part of the stomach, kidney, again adrenal gland. And I will go back there, but I just want to move now. We've done that. This is waistline, which is my measure to target my reflex point. Intestine, as I said, this is large intestine, which starts from here, ascending colon, transfer colon. From waistline, I go towards the foot, lateral to medial, transfer colon, and all the way down here, descending colon. About 4 or 5 times, depends how much it needs to be done. There is no fixed number or repetitiveness. It just is important to do it intuitively and intentionally. It's important to be intentional about, of course, and intuitive about. If you feel some work needs to be done on a specific reflex point and organ, just work on it until it feels looser and freer. Sigmoid colon and the rectum that exits towards here. Yes, when you work in digestive system, colon, intestine, large and small intestine area, you do one. I do one part and then move to the other side so I can complete, rather than doing one side and leaving that one. I tend to complete the treatment, and then from there working on the bladder, obviously. This area, which is I just moved now, lower back and reproductive reflex point, which is medulla, the ankle bone here, and the base of the foot. I just put my 3 fingers, and the mid part is the reflex point. For men is prostate, for women is ovaries. I just do gentle acupressure. And the lateral border, the other side, is for men testicle, for women ovaries. I try to hold pressure and ask my client to breathe in. Can you breathe in and breathe out? Again, just 30 seconds. Just depending on the client, if they have any period problem or any condition, or depends. And then I carry on just my lovely caterpillar walk. Thumb walking, and here, because it's a wider area, I can do with my 2 fingers, finger walking all the way up. This side is the same. Again, this dorsal aspect here, it's the fallopian tube. You can also do from lateral to medial or medial to lateral, as well as you can do same time medial and lateral and coming to the front. As I said, there is no, depending on your training and depending on the reason why you're doing it. And it's always nice to do sweeping around shoulder all the way down towards the lower back. And knuckling on the, this is sciatic reflex point at the lower back. It feels very tight. It feels good when you do firmly, confidently knuckling there. I can feel a crunch if it's very tight, isn't it?
Yeah, I can feel the crunch.
Yes, it just indicates that your lower back feels tight. Now I'm going to slowly move to the left foot. I can feel already the right foot loosened up. It's nice to cover and hold while working on the left foot. I'm doing the same thing, the sweeping, and we can do both sides, sweeping, top to bottom, around the ankle area. It feels such a lovely area for, again, this, not knuckling, it looks like I'm knuckling, but I'm not, I'm just sweeping towards me. It's such a nice area to loosen up all this lower back area. I already talked in great detail while I was working on the right foot about toes, reflex point, and the respiratory system, diaphragm, digestive, etc. The caterpillar or thumb walking. I'm just working on the spine all the way down to coccyx, which helps to calm down and relax body. If you want to stimulate and energize your client, if needed, I start with coccyx and go all the way up to neck, cervical, C1. And sometimes I go top to bottom, bottom to top. It just depends. If my client presents neck pain, neck tension, or head, as I mentioned earlier on, or head, I try to pay attention and spend more time this particular reflex point as much as I can, just to loosen up. So body, we just help body to do the job. We're not doing the job, we're just working with body, so body can realign and readjust and alleviates pain, discomfort, whatever needs to do. Our body knows the best. We just guide, help her as a therapist. And also, if client wants to relaxing, calming, which often that's the case. They either have a stressful life or whatever is going on in their life, they prefer to have relax after the treatment. So approach is to help them via reflexology, sedating, helping the nervous system to calm down. So the session can be much more subtle, softer, slower movement. But if someone has already very low energy, fatigue, etc., wants to energize, it can be a bit faster, stimulating, to helping body to stimulate and energize. And therefore, my movement, my sequences that I'm doing, for example, thumb walking, be a bit more speedier. As I said, it depends. And also depending on the feet conditions, like here I can see some crunchy tightness in the shoulder area. I always apply acupressure and hold, as I mentioned earlier on, 30 seconds. Breathe in, Melissa, please. And slowly breathe out. Beautiful. You can do one more time. Wonderful. Yeah, Melissa's lovely feet, especially chest area, on the right foot and the left foot, it feels quite tight according to feet. working in the chest area right now, trying to loosen it up. It feels really tight and crunchy. Again, this helps to loosen up the joint. If someone has arthritis, obviously through consultation, you should know that. And this movement, rocking, rotation, etc., you have to be careful with that. Therefore, consultation is very important to get contraindications, etc. You might want to know what is the main contraindications to reflexology. Just a few of them I can mention here. Obviously, if there is any fracture or broken foot, definitely it needs to be avoided that area, or unhealed wounds, or cut. What else? If there is any underlying condition, you have to be careful and check. Early pregnancy is not advisable. At least you need to wait for first trimester before you offer reflexology if someone wants to have a reflexology. I've been seeing many pregnant patient clients, as I do offer pregnancy reflexology as well as reflexology for normal people, male or female. So it's very important. Yeah, the kidney, adrenal gland, tight. Typically, when I see my client in the treatment after initial consultation of his regular client, we start with session. At the beginning, we chat, we talk, and ask them about if there's anything that they can ask me. But preferably, I don't talk. I just do my treatment. And if client wants to ask something, of course they can ask. I encourage them to ask. But other than that, I let them to relax, enjoy. So I try not to talk. I just focus on my treatment. And if they need to ask or say something, they can during and after the session. Because of the purpose of the treatment is a test there, and they show you just the main basic techniques of reflexology treatment. Chatterbox. Okay. Earlier on, we already done the small intestine, large intestine here. I'm just going over again to check. Before I move to lower back part, Sometimes I do gently from top to bottom. This actually works fascially, structurally. It helps to loosen up the, when I say fascia, it's a connective tissue. We wrap that with, it helps to loosen up. Oh, and it feels so good. Very slowly. This also helps if someone has plantar fasciitis, which is inflammation of the fascia, this particular part, this area. Now I'm doing thumb walking again. If someone has sciatica or lower back pain, this is a sciatica reflex point. I normally I work that area, and afterwards I apply with my thumb acupressure, and I ask my client to breathe in and breathe out towards the pressure that I'm applying to help to reduce the sciatic pain. And often it works. And again, working around the ankle. You can do it with one finger, one like finger walking. In this area, sometimes I switch with thumb walking. The same applies to the medial border. Yeah. And Fallopian, it feels so good. The benefit of the reflexology is immeasurable, actually, especially when it's been done on a regular basis. If you can do every fortnight, brilliant. It typically it depends, but it takes 4 or 5 sessions on a regular basis to get the benefit, depending on the reason why you're having reflexology. But it's generally within 4 or 5 sessions you get the result, whether it's for insomnia, digestive problem, circulatory problem, or headache, etc. Just a few more minutes and we're going to try to finish, because almost I covered almost everything. Or I forgot to something to mention, but I've done my best overall to show you as much as possible. It already feels much, much looser whole feet. This, I think I already mentioned, this top part is our chest, and in the metatarsal joint, you can, with finger walking, you can go all the way down. It helps for lymphatic system and the joint to loosen up. All this tension in the chest area, it really helps to loosen up. We worked on this area, as I mentioned, respiratory system and the front part as well. About 5-6 times if I walk straight down, or I can hold and do thumb walking. It's such an effective technique and movement. You can go straight all the way down, all the way in the joint. And I repeat on this side as well. I go back, as I mentioned, I switch. I start with right foot. After I work on the right foot, I move to left foot, work there, and I switch to right foot again, checking the tissue, the texture, everything. If there is anything that still work needs to be done, I go back that specific point and do a little bit of work, whether it's acupressure I apply or a little bit of thumb walking or knuckling or whatever, until I get the result that we want. So feet can be happy. It seems very happy. Let's do on this foot as well. That nice fascia work. I don't always do this. It just depends if foot, as I said, structurally tight, tense, it helps to loosen up. Or if somebody has plantar fasciitis, etc., it really helps to loosen up the fascia. I'll just do a couple of times. It's not the part of traditional, typical reflexology treatment, but there is no rules. I add or incorporate whatever works for us. I'm just going to put a little bit more lotion. It really feels wonderful. It feels soft, loose, subtle, whole area. What do you think, Melissa? Agree or disagree?
I agree. I was falling asleep. Oh my gosh. Feels so nice.
Lovely. Your feet are really loose. Much, much looser. Look at the shoulder. Wow. Chest. I know sounds like talking highly about myself, but my intention is about the power of reflexology. That's where my intention to share. Lovely. It's always nice to finish the session with breathing while I'm holding the solar plexus, which is here. This is our diaphragm, solar plexus here. It helps it calm down, relax, and relaxing and grounding. When you're ready, Melissa, deeply breathe in and slowly breathe out. And bring all your intention to your body. Breathe in again. Breathe out. One more time. Beautiful. I hope you enjoyed it, viewers, your lovely old followers. And if you would like to have a reflexology with me or other modalities, and my website link will be on Melissa's YouTube channel, so you can have more information there. I hope you find useful and helpful. Thank you so much.
Thank you so
Bye.
much.